Yeah, where do you kill grandma in that? Where's the... Because I know that's in there.
No death panels, no killing your grandma, no socialism. You know, I had an interesting debate with a Republican friend who said, isn't that socialism, Steve? And I said, well, no, it's not at all, really. I said, I'll tell you, and go to a doctor from now, any time going forward. Go to pay for prescription drugs, go to a hospital, and try to make out your payment to U.S. government and see how that gets you. Okay. This is not a socialist program. The government, doctors do not work for the government now. Hospitals are not government-owned. Pharmaceuticals are certainly not government-owned. Okay. It's not a socialist program, plain and simple.
It's just regulated.
It's just regulated.
But Steve, did you calculate the cost that is going to be on those families? Okay, you're going to receive subsidies and tax credit, but they're going to be a cost to be covered, right?
Excellent question. Can we go to the next slide? Okay, so as I mentioned, we're going to go into some case studies on families. So families with 4 members, an income of $42,000 a year, they don't get health insurance provided at work. How's that going to affect them? Beginning in 2014, you're going to receive tax credits to ensure you don't spend more than $1,680 to $2,600 per year on premiums. The reason for the range, that's not completely set in stone just yet, but that's the range that you're going to have to pay for premiums per year. Your out-of-pocket costs for deductibles and co-payments will be capped at 15% of the total cost. That's the maximum it could be. I've had a couple of people ask me about this, and this is the way I try to explain, but this is the way I recommend to people who are going to be in situations with tax credits. Okay, so 2013 comes. In November, December, go get a couple of estimates on health insurance from a couple of different companies. Pick one you like. Let's say that your cap ends up being $2,000 per year for premiums. And the health insurance coverage, just to make it a nice round number, will cost you $10,000 a year. Okay. So your tax credit is going to be $8,000 that year to help pay for premiums. My recommendation: go to a tax preparer. Okay. Find out what your tax liability is going to be for that year, and then ask them to help you fill out another W-4 to lower the amount that's going to be taken out each month by 8,000 divided by 12. Take that amount that you were going to have to pay for taxes and not going to have to pay anymore, and use that to pay your
raise the exemptions.
Right? Raise the exemptions. Any questions on this?
Can I ask a quick point?
Yes.
To Martha's point, if you are an employer with less than 50 employees, you will not get penalized.
Is it 15 or 10?
It's 50. No, 50. If you have less than 50 employees and you're a small business, you will not get penalized.
Right.
We go on this. Oh, I'm sorry.
That's okay.
I just.
And by the way, Ryan has brought some literature.
Yeah,
we're going to put, of course, the slideshow on the site, and we're going to have the slides available on Facebook. So there are all kinds of ways to get back to this. But in essence, and I guess what Steve is saying also, this is really a pretty good thing to crow about. And yeah, Fox News is not going to do that for us.
Right.
We're going to have to communicate to folks, on ground level, that they should be talking about this bill and supporting it, because this is a major win. This is a major, like Joe Biden says. Yes, it's a. So we need to talk about it because we worked so hard for this, and not to get too political, we worked so hard for this for the last couple of years. Now we got it. All right. So all this monkey muck about this administration not doing anything, and all this other stuff and all. This is major. This is major. This is historic.
Can I tell something?
Yes.
I think very importantly, Steve mentioned a couple of places that I noticed where there's mandated state level action, right? So the shop exchanges, the appeals process, right? And all of those things take legislative action set up. And I will guarantee you, I work for the state legislature, right? I will guarantee you that Blue Cross Blue Shield and there are other cohorts in the insurance industry are absolutely going to be in Albany to make sure that the manner that in which these programs are set up are in ways that are as beneficial for them as possible.
Right.
And so I think it's incumbent upon us, the advocacy, the kind of ground level work isn't over yet.
Right.
And I think that, what is going to be critical is to figure out, from a legislative perspective, what bills are potentially going to be floated. We need to analyze those bills.
Right.
And we need to determine the mechanisms that can put in place that are most beneficial for the people that we care about and the people in our community.
Right. We definitely need to be in the ear of the people who are going to Albany for us, at least one ear, because Blue Cross is going to be in their ear. In the absence of us, you know what's going to happen.
Activism is required now on multiple fronts, and I'm glad you brought that up. Number one, the state level, as you were just mentioning, to make sure that the way the appeals process and everything happens is a way that's good for consumers as well as companies, and companies we represent. But also in terms of not allowing people to sell short all the things that I just talked about. Because the Republicans are going to be trying to say, this is terrible, this is awful, all these terrible things are going to happen. There's nothing terrible in here, right? There's nothing terrible in here. And we need to get that message out, because Republicans are definitely going to be getting out the opposite message. One thing that I want to say, penalties for not having coverage for folks. One of the things you'll notice, the maximum here of the penalty is pretty similar to the maximum that you would have to pay for premium. There's a lot of negative stuff that's been said about these mandates and penalties. Okay? Why wouldn't you get the health insurance in this situation? Anybody?
Say that again?
Why wouldn't you get the health insurance coverage in this situation? Because the premium is the same as the penalty. Maximum.
Cash flow. All right, so this is my personal issue with this whole thing. So if we take one of the many single mothers that's raising 3 children here in Central Harlem, who has to decide how I'm going to feed my children, how I'm going to get to work, versus paying that. What type of penalty lies in wait? There's that. But what happens when she still can't pay that? What happens? That's not detailed.
Well, give me an income level, because
I'm not. It's no income level. This is people level. This is people level.
That's why
I'm asking. Despite the income level, take any single mother, whether she's made enough money or not, her lifestyle, her circumstances are what they are. Unique to her and her family. So the way I look at it is, I cannot reasonably make sense of how you enforce this on a single mother with 3 people, with 3 children under her care. If she can't afford the $2,000 now, can't afford it at income tax time, can't afford it at all because she just cannot afford it, what's next? How do you enforce this? Are you going to take a single mother and take her driver's license away? Are you going to imprison her?
No. There's no jail for that.
There's no specification on how they're going to enforce that when the person still can't pay the penalty.
The problem with what you're saying is, I need to know her income level, because if she's making 133% of the federal property level or less, she pays nothing.
Right. Medicaid.
Right.
But if she is, we're talking lifestyle. How many of us make?
Well, 133% of the federal poverty level could be like
It's 29,000.
29,000. Okay, so
at 29,500.
Right.
That $500 is not going to make that much of a difference of her maintaining her lifestyle for her and her 3 children. It's not. If you know people that live paycheck to paycheck, which many of us do, it doesn't make sense when you can't pay the bills like my mother and my grandmother taught me.
Yeah, but there's an answer. Let me explain what the answer is.
Let's say the answer, and we need to move it because we're almost here.
Let's say 29,500. Okay. The amount of premium goes down depending on how close you are to that 133%. So at 29.5, her maximum premium would be about $700 or $500 or $300 a year through tax credits. Okay. I mean, so that's $30 a month, $40 a month.
And Steve and Brian.
And there are also hardship provisions in the bill for specific cases where you can. Yes.
Steve and Brian, can you be available offline?
Sure.
These are good questions. I want to answer, but yeah.
You get their cards.
So next.